and welcome to August edition of FAS TV's Veterinary Update. I'm Fiona Crowden, one of the vets that works for SRUC Veterinary Services. So July has seen pretty showery weather ongoing, and that's going to extend into August till at least the middle of the month, with temperatures remaining about average for the time of year. This means that all of the parasites, the gutworms and the lungworms that Helen talked about in last month's update, are still going to remain a risk for your stock at this point in time. Haemonchus is a blood-sucking worm, and therefore you don't get diarrhoea. What you do get is pale mucous membranes, so the membranes of the eye can become quite pale, and you can see lethargy in sheep, weight loss, and some bottle jaw, some fluid collecting around the jaw of some sheep. This means that quite commonly in Scotland it gets misdiagnosed as fluke. Diagnosis of haemonchus is reasonably straightforward. High fecal worm egg counts, especially in the thousands or tens of thousands, are really very suggestive, especially if that's combined with clinical signs. And we can then do a special stain on the worm eggs in the faeces samples and identify them definitively as haemonchus eggs. Treatment is using just your usual anthelmintics. However, because haemonchus can be quite prone to developing resistance, if you are suspicious of, or if you have diagnosed haemonchus on your farm, it's definitely worth getting in touch with your vet to plan a strategy for the long-term management of haemonchus on your farm. Another parasite we should think about this time of year is sheep scab. We see a peak in diagnosis of sheep scab from about October onwards, and this is associated with the movement of sheep during sales over the next few months. So it's well worth, if you're thinking about selling breeding animals or selling stock onto other farmers, you can check the scab status of your flock. The problem with sheep scab is that the mite, which is transmitted between sheep by direct contact, can take months, weeks, even months to cause clinical signs. These clinical signs include restlessness, itching, staining of the fleece over the shoulder, and a yellow crust developing over the skin. So it is possible that you could have sheep scab in your flock but not manage to detect it by seeing the clinical signs yet. So if you want to check whether there's scab without the clinical signs, there's a blood test, and that blood test can go positive within 2 weeks of becoming infected. So the test requires 12 sheep from each management group to be tested, and that'll give you an idea whether there's scab within that group of animals. Preparing for a sustainable farming initiative in Scotland will provide funding for this testing. So it's worth talking to your vet as to whether you should consider this as part of your two animal health and welfare options. If you've purchased sheep, you can think about also doing the blood sample following purchase and before you introduce those sheep to the rest of your flock to make sure that they are not carrying subclinical infections of scab mites. So moving to cattle, we see a peak in diagnoses of blackleg in cattle in the later months of the summer. Blackleg is a bacterial disease caused by Clostridium showery. This bacterium forms spores, and these spores can be present on pastures and can survive there for years. These spores are ingested when the cattle are grazing and make it from the gut into their bloodstream. From there, they settle into the muscles where they remain. If there's something that happens that decreases the amount of oxygen in that muscle, be that body muscle or heart muscle, so that can be like a trauma or a bruise forming, the spores then germinate and the bacteria can multiply within that area of muscle. They release a toxin which causes necrosis, so killing off of the muscle, and forms these black dry lesions that we associate with blackleg. These toxins also enter the bloodstream and can cause the sudden death of animals. We see blackleg most commonly in cattle under 24 months old from about 2 months old, most commonly in the southwest of Scotland, although we do see cases over the whole of Scotland. More commonly in beef animals, and usually the stronger, more well-grown calves within a group. So rather typically it's always you're seen in the best animal in the group. If you do have sudden deaths and you think it could be blackleg, post-mortem examination is the best way of diagnosing it. We can detect the dry lesions in the muscles, as I say, be that forelimb, hind limb, sometimes the lumbar muscles of the back, occasionally the tongue, and quite commonly around the heart in young animals. We can then do a special stain, a fluorescent antibody test on these lesions to confirm the presence of the bacteria within the muscle. Prevention is by vaccination, so that is usually 2 vaccines 6 weeks apart, 2 to 3 weeks prior to the risk period. The main challenge for vaccination in cattle is handling of the cattle to give the vaccines prior to the period of risk. It's quite a cheap vaccine, so commonly used in farms that know they have a problem. If you do get sudden deaths that you think could be blackleg, get your carcass to either a post-mortem centre in Aberdeen, St Boswell's, Glasgow University or Dumfries, or get an on-farm post-mortem done by your vet. This will allow you to get the diagnosis and plan to vaccinate next year.